I know you told your friend you're not okay, and tell me what's wrong and why you never said you felt that way. And guess you're trying to stay strong.
And decrease range of motion of the knee. In arthritis, the cartilage of the knee gets worn off. And the meniscus, which absorbs the shock, degenerates and tears. And with time, there will be more and more degeneration and wear and tear. The joint space becomes narrower and narrower. And when the cushion of the cartilage is completely lost, the bone will rub against bone, and that will cause severe symptoms to the patient with severe pain, inability to walk, a lot of swelling, and the knee will give away. The knee will be unstable. The X-ray will show the arthritis. Here is a normal knee showing the normal joint space, and here is the knee with arthritis that shows severe arthritis of the knee and bone.
I was asked by a patient recently who watched one of my TikToks to provide some advice for osteoarthritis of the knee. Now, let me give you some advice for osteoarthritis with the knee. As with all arthritis, losing weight is a great idea. That's the first thing. Number two, as with all arthritis, doing mild to moderate exercise, motion is lotion, is a good idea. You can see a theme developing here, can't you? As with all arthritis, number three, getting stronger. So doing some exercise that involves in getting some key core muscles a bit stronger is a good idea. I like the use of supplements. So that's my number four. I like glucosamide and chondroitin. Both are very good supplements. And obviously, as with all arthritis, injections of corticosteroids or Ostanil can help.
This is what it really looks like. A camera's inside the knee. So there is cartilage that's thick, but then you can see divots and potholes. This damage to that cartilage, that's what arthritis looks like.
Okay, great question. How many years do they last? Most total knee arthroplasties, or TKAs, will last 10 to 15 years. I've seen some last up to 20. The oldest one I've ever seen was 22 years. And the issue is, like, I'm here at the car dealership dealing with my car. It's about the parts that fail. So either the parts that are going to fail are the cobalt chrome implant that goes on the femur and the tibia, or the plastic liner that's in between those things. And normally the plastic liner, or we call it the poly liner, it can fail sooner than later. So those are the things that wear out before. The other part is between where the metal and the bone interface. If it's not a press fit, meaning we didn't use cement, it can loosen with time, just wear and tear, especially if you're high impact. If it's between cement, the cement bone interface between the metal is sort of like the middle part. You have metal, cement, and then bone. That's what's going to fail before anything else. And so those are the things that we look for on x-ray, why it's important that you get an x-ray.
I get this question a lot. What's the best age to have a knee replacement operation? There is no best age. It's really based on quality of life. When you have a poor quality of life because of bone-on-bone arthritis, that's the time to have a knee replacement operation. Implants are very good. They're lasting a long time now.
Everything you know about fat loss is wrong. Some people will tell you that walking isn't good for fat loss, but they have no fucking clue what they're talking about. Other than controlling your calories, it's one of the best things you can do. In fat loss society, it's super beneficial for overall health. Remember, we care about overall health here as well. It increases cardiovascular health, helps to reduce your risk of heart disease and stroke, helps build stronger bones and improves your balance, and it can improve your muscular strength and endurance. And it doesn't take much. Aim to get 20 to 30 minutes of walking a day. And if you can't do it all at once, that's okay. Break it up into smaller 10 to 15 minute walks. As long as you are physically able to do so, you should be walking. And if you found this video helpful, give me a follow for more no bullshit content like this.
Don't debate me on this. This is the best cardio to shed body fat while still sustaining your muscle. Swimming. It puts low pressure on the joint. It improves your cardiovascular. And because there's still some level of resistance, it's good for your muscles. So you won't be losing gains. Try it out. Swimmer's body,